This Guy's Garage. Like and subscribe.
All right. Dr. Ellis.
Thanks very much, Chair. I think that we adjourned debate last time on a very important motion related to this bill, which specifically respects the data that has been egregiously reported here in this committee with absolutely any evidence. And, certainly as we begin to look at that, I think that we need to return even to the original omnibus bill in which the changes that originally occurred, transforming natural health products to therapeutic products, which was done, of course, as I said, in an omnibus bill, which attempted to hide that, I think, to the public. That being said, during that original time that we heard from witnesses from Health Canada, and we specifically heard from Dr. Supriya Sharma, we know once again that data was referred to which has never been substantiated. And the sad fact of the matter is that simply because the obfuscation of witnesses who were here this time, they absolutely refused to provide that data. And the sad part of it is, in spite of many disagreements we've had at this committee, we have had the ability to have documents tabled here, which has been a regular occurrence, thankfully. And it's something that we've agreed to. Sadly, that couldn't occur at this time. And subsequently, I moved a motion for ISMP to provide the dates of occurrences, the specific substances that were in question, the outcomes, etc. And it's interesting, I had the opportunity to review the footage from that meeting, and I asked representatives from that group 3 times to come forward and provide data to substantiate their claims. And each time they talked about privacy, they talked about, it was very unclear what their point was. My point, though, is very clear. If you want to come and make claims about an industry that is a $13 billion industry that is mainly comprised of small and medium-sized businesses here in Canada, that is an incredibly important, often a family business, often run by women, then you need to substantiate your claims. And that is something that is absolutely egregious not to be held account by our Liberal and NDP counterparts who adjourned debate on this particular motion at the last meeting. So, on behalf of those entrepreneurs who really want to be able to continue to ply their business in our country, shame on the Liberals and shame on the NDP for adjourning debate. We could have settled this already, but once again, for reasons unbeknownst to me, perhaps it is the return of the marriage of the NDP and Liberal leaders, despite the much touted public tearing up of the agreement. Clearly, everybody knows that the renewal of vows has reoccurred. So as we begin to look at that,
Point of order from Mr. Julian.
I'm certainly questioning relevance because Dr. Ellis is off on a tangent, but I'm also a little bit perplexed. This is really important legislation. I'm glad that Mr. Calkins is here with us today, and we have important amendments to consider on the bill. Perhaps Dr. Ellis could share with us why he's filibustering this bill.
Dr. Ellis is talking about things that were relevant to the bill, and I expect at some point he's either going to introduce a motion either to resume debate or a brand new motion along the same lines. That's what I'm waiting for. But he's on a topic that will lead to that. We'll see where it goes.
Now, they were again very unclear in what they presented. One of the claims, if I remember correctly, and again I looked at the footage, was that somebody read the label wrong, got the wrong product, and was upset because they couldn't get a refund. Now, I don't think that that is a side effect from a natural health product. I think that's a side effect from not reading properly. But that's my own opinion. All the way to their egregious claims of multiple deaths. Now, again, why is this important? It is important because people should not be able to come here and make egregious claims without data to support what they are saying. We even had a physician from Sick Kids who was here saying that multiple children died because of natural health products, but once again refused to provide any cases. I asked that physician specifically, how many children were there? What did they die from? What was the toxic substance, et cetera, and there was no answer provided. So it is this comedy of events, they're not even errors, and it's certainly not funny that people come here and make egregious claims against the natural health product industry, and nobody here, besides the Conservatives and the Bloc, want to hold them to account. The NDP Liberal Coalition wants to adjourn debate on this specific motion,
Point
and
of order.
clearly that they do not want to have this
Point of order
information
from
before
Mr.
committee.
Julian.
Again, Mr. Chair, I want to cite relevance and repetition, and I'm kind of flabbergasted. This is a bill that the NDP supports, that Mr. Calkins has presented. We have important amendments to consider, and it's being filibustered by the Conservative health critic. I just don't understand at all the objective, but he is repeating himself, and he's not relevant to the debate. And I would ask you, Mr. Chair, has he actually moved a motion, or is he just speaking?
He hasn't moved a motion. He is just speaking, but he is speaking to the bill. It's hard to say that it's not relevant. I'm sorry, Mr. Julian. Go ahead, Dr. Ellis.
Well, thanks very much, Chair. You know, and again, I want to point, I think this is worthwhile pointing out, and I know it's painful to Mr. Julian, but the sad part is that Mr. Julian was that we knew that the Liberals were going to vote against this because, of course, they moved the original bill to gut the natural health product industry. And I think it's shameful for Mr. Julian to have been the one to adjourn debate on bringing forward data that is specifically related to this bill and to the natural health products industry, from which he claims that he's a huge supporter. Now, not to mention the fact that one of his amendments that he has brought forward is basically a wrecking amendment towards Bill 368. And as you begin to consider his amendment, I think that we'll find that we'll ask you, of course, Chair, to rule against the admissibility of his ridiculous amendment as we go forward. So with that, I think it incredibly important that we resume debate with respect to the data that we have requested at the last meeting related to the natural health product industry, because it provides important context for Canadians to understand that by and large, this is an industry which is safe, which is effective, which is proudly Canadian, which, if the NDP Liberals are allowed to have their way, will wreck the industry, will drive businesses out of Canada, and force Canadians to purchase products online, which, again, will never be tested up to Canadian standards because there's no law requiring them to. They will be able to access products from any jurisdiction which they wish. And we have an opportunity specifically to ensure an industry which we've heard multiple testimonies related to the safety and the interest of those involved in the industry, of how safe and they're willing and open to have changes. We've talked to them that they're willing and open to have changes with respect to removing nicotine containing products from natural health products. And we also know that the concept of recall, and I know that our colleague from the Bloc has submitted specifically an amendment with respect to recall that we certainly would support, which makes perfect sense. We heard clearly that inside the industry that moving amendments related to those two things would make perfect sense. So, very specifically, Chair, with those things in mind, I move that we resume debate on the motion I proposed at last committee meeting, which was adjourned by the NDPs and Liberals, to demand that ISNP bring forward data that they cited at that last meeting as well with respect to natural health products. Thank you.
A motion to resume debate is a dilatory motion that is not debatable, so we will go straight to a vote. But just for clarity, the motion that Dr. Ellis moved at the last meeting, which is the subject of the motion to resume, reads as follows: that the Institute for Safe Medication Practices Canada provide the list of 700 incident adverse reactions, the date of incident, product, and outcome to the Standing Committee on Health within 30 days. So the question for the committee is, shall the debate on that motion resume? All those in favor?
Chair, I'd like to request a recorded division, please.
Madam Clerk, a recorded division has been requested.
Mr. Henley,
No.
Madame Kayabaga,
No.
Mr. Nakvi,
No.
Mr. Polowski,
No.
Madame Sidou,
No.
Mr. Ellis,
Yes.
Mr. Majumdar,
Yes.
Mrs. Goodrich,
Yes.
Mr. Calkins,
Yes.
Monsieur Thériault,
No.
Mr. Julian.
No.
Yeas 4, nays 7.
So the motion is defeated